Why do Parkinson's patients experience cognitive decline? Imagine a brain that starts to change in many ways, not just in the parts that control movement. That's what happens in Parkinson's disease, a neurodegenerative disorder that affects more than just motor skills. While many people know Parkinson's for tremors and stiffness, it can also lead to cognitive decline, which means problems with thinking, memory, and decision-making. But why does this happen? The main reason is that Parkinson's affects multiple brain systems, not just the area that produces dopamine, a chemical that helps control movement. Early in the disease, dopamine levels drop mainly in the part of the brain called the substantia nigra, which leads to movement issues. However, as the disease progresses, other brain regions are impacted too, especially those involved in thinking and memory. One key factor is the disruption of the cholinergic system, which uses a chemical called acetylcholine. This system is vital for memory and attention. When cholinergic neurons in the brainstem and cortex are damaged, it can cause significant problems with thinking and focus. This damage often plays a bigger role in cognitive decline than dopamine loss alone. Another important aspect is the presence of Lewy bodies. These are abnormal protein clumps made mainly of alpha-synuclein that build up inside neurons. They tend to accumulate in areas of the brain involved in cognition, such as the limbic system and the cortex. As Lewy bodies spread, they interfere with normal brain function, making thinking and memory worse. Some patients also have signs of Alzheimer's disease, like amyloid plaques and neurofibrillary tangles. These are typical in Alzheimer's but can also appear in Parkinson's, especially in those with more rapid cognitive decline. When these Alzheimer's-related changes are present, they can speed up the progression to dementia. Other neurochemical changes, like alterations in norepinephrine and serotonin, can also contribute to cognitive and mood symptoms. Genetics can play a role too. Certain mutations increase the risk of developing cognitive problems in Parkinson's. Additional factors such as strokes, inflammation, mitochondrial issues, and reduced growth factors can further damage brain networks involved in thinking. Cognitive changes often start subtly, with difficulties in planning, problem-solving, or visual spatial skills. Memory problems may also develop, and over time, some individuals may progress to Parkinson's disease dementia. The speed and severity of decline vary widely among patients. Diagnosing cognitive decline involves clinical assessments, cognitive testing, and sometimes neuropsychological evaluations. It's important to distinguish Parkinson's-related cognitive issues from other types of dementia. Currently, treatment options are limited. Some medications that boost acetylcholine levels, called cholinesterase inhibitors, can provide modest benefits. Researchers are actively exploring new ways to slow or improve cognitive decline, but no definitive cure exists yet. In summary, cognitive decline in Parkinson's disease results from widespread brain changes affecting multiple neurotransmitter systems and regions. Lewy bodies, Alzheimer's pathology, and neurochemical imbalances all contribute to the process. Understanding these mechanisms helps us develop better strategies to manage and potentially slow cognitive deterioration. If you or a loved one are experiencing these symptoms, it's essential to consult healthcare professionals for personalized care and support.